Hello everyone, this is your English friend with a new video where I'm going to explain the part A and B of a passage named The Use of Feeding Tubes in Pediatrics, which has been released by Cambridge. Part A, questions 1 to 7. For each question 1 to 7, decide which text A, B, C or D the information comes from. You may use any letter more than once. In which text can you find information about? First information. The risks of feeding a child via a nasogastric tube. This information can be found in the very first text itself, in text A, where you can see pediatric nasogastric tube use. And here in this part, they have given us some risks. Issues associated with pediatric nasogastric tube feeding include procedures for inserting the tube is traumatic for majority of children, and then tube is very noticeable, and the remaining are also other risks. So the answer is quite easy, it's A. Question number 2. Calculating the length of the tube that will be required for a patient. This information can be found in text B. Here they are talking about the range of sizes of pediatric use is 6 French to 10 French. As we come down here, they are talking about tubes come in range of lengths, usually 55 centimeter to 75 centimeter or 85 centimeter. However, the question is about calculating the length. Here you may see measure from the tip of the nose to the bottom of the earlobe, then from the earlobe to cephasternum. The length of the tube can be marked with indelible pen or a note taken from the measurement marks on the tube. So this is how the length of the tube is calculated. So the answer for question number 2 is B. Now question number 3. When alternative forms of feeding may be more appropriate than nasogastric. So that can be found in text A. Here in this paragraph, here it says nasogastric is the most common route for enteral feeding. It is particularly useful in short term and when it is necessary to avoid a surgical procedure to insert a gastrostomy device. And here, there lies our information. However, in the long term, gastrostomy feeding may be more suitable than nasogastric feeding. So answer for question number 3, it's A again. Question number 4. Who to consult of a patient's liquid food requirements? Answer for this question. This information can be found in text D. Yeah, here in this text. Here in the first line, we may see administering feeds of fluid via feeding tube. And in the second line, we have got our information. Feeds are ordered through a referral to the dietitian. So answer for question number 4 is D. Who to consult our patient's liquid food requirements, and that's a dietitian. So it's D. Question number 5. The outward appearance of the tubes. That is kind of easy. It's in text B again. Here you may see all tubes must be radio opaque throughout their length and have extremely visible markings. So that's the information we want. And answer for question number 5, it's B. Question number 6. Knowing when it is safe to go ahead with the use of a tube for feeding. Answer for this question or this information can be found in text C. Text C is all about the procedures that must be done before the tube is used for feeding. Here you may find estimate NEX measurement, insert fully radio-opaque nasogastric tube for feeding, confirm and document secure NEX measurement, aspirate with a syringe using gentle suction. And here you may see aspirate obtained. If it is obtained, this is the thing that must be done. If it is not obtained, these are the other procedures that must be followed. And here aspirate is not obtained again, then that is done, or else they need to proceed to here on the left side. And if the pH is well in between the required 1 to 5.5, 1 and 5.5, then they should proceed to feed or use tube. Otherwise, that should not be done. If pH is not between 1 and 5.5, this is the procedure that should be followed. Then there the competent clinician to document confirmation in nasogastric tube position in stomach. Again, if it is negative, do not feed or use tube. That's it. So this is how they know when it is safe to go ahead with the use of a tube for feeding. So answer for question number 6 is C. Question number 7. How regularly different kinds of tubes need replacing? Answer for this question can be found in text B. So let's go to text B. So the question is about different kinds of tubes, and here we may see 2 different types. All tubes must be radiopaque throughout their length and extreme externally visible markings here. Wide bore and fine bore. Wide bore is for short-term use only and should be changed every 7 days. And when it comes to fine bore, it's for long-term use, so it should be changed every 30 days. And this is the information what question 7 is asking for. So answer for question 7 is B. Now question number 8 to 15. Answer each of the question 8 to 15 with a word or short phrase from one of the texts. Each answer may include words, number, or both. Question number 8. What type of tube should you use for patients who need nasogastric feeding for an extended period? So that is quite clear from text B. Here you may see wide bore type of tube is used for short term and fine bore is used for long term. And that's what question is about. Who need nasogastric feeding for an extended period. So answer for question number 8 is fine bore. Question number 9. What should you apply to a feeding tube to make it easier to insert? Information regarding insertion can be found in the same text B here. Find the most appropriate position for the child depending on age and all. As we read further, here you may see lubricate the end of the tube using a water-based lubricant. Gently pass the tube into the child's nostril, advancing it along with the floor of the nasopharynx to the oropharynx. So water-based lubricant must be applied before insertion to make it easier. So answer for question number 9, it's water-based lubricant. Question number 10. What should you use to keep the tube in place temporarily? This information can also be found in the same text. Here it says, lightly secure the tube with tape until the position has been checked, which means a tape can be used to keep the tube in the place temporarily. So answer for question number 10, it's tape. Question number 11. What equipment should you use initially to aspirate a feeding tube? Information regarding aspiration can be found in text C. Here, you may see in the first box, last point, aspirate with the syringe using gentle suction. So answer for question number 11 is syringe. Or it can be even a syringe. Question number 12. If initial aspiration of feeding tube is unsuccessful, how long should you wait before trying again? That is also in the same text here. Aspirate obtained if it is no. These are the steps to be followed. And here in the third point, you may see wait for 15 to 30 minutes before aspirating again. So answer for question number 12 is kind of easy. It's 15 to 30 minutes. Now question number 13. How should you position a patient during a second attempt to obtain aspirate? Answer for this question can also be found in the very same area where we got the answer for question number 12. Here it says in the first point, if possible, turn child or infant onto left side. So answer for this question is on left side, or you may write so answer can be written as on left side, or if it is needed, you may write turn on to left side. Now question number 14. If the aspirate exceeds pH 5.5, where should you take the patient to confirm the position of the tube? So regarding the pH, here you may see if the pH is not between 1 and 5.5, or in other words, if it exceeds 5.5, proceed to X-ray. Ensure reason for X-ray documented on request form. So the answer is to X-ray. You may write department if you need, or the answer can be even radiology. Now question number 15. What device allows for the delivery of feeds via the small bowel? Answer for this question can be found in text D. Here in the third part you may see when feeding directly into the small bowel, feeds must be delivered continuously via a feeding pump. So answer is quite direct. Answer is A. Now question 16 to 20. Complete each of the sentences 16 to 20 with a word or short phrase from one of the texts. Each answer may include words, numbers or both. Question number 16. If a feeding tube is not straight, when you unwrap it, you should dash it. Answer for this question can be found in text B. Here in the second bulletin point, check the tube is intact, then stretch it to remove any shape retained from being packaged. So this is the idea. The idea from being packaged is actually given by the term unwrap in the question. So answer for question number 16 is stretch. Question number 17. Patients are more likely to experience DASH if they need long-term feeding via a tube. This information can be found in the first text where they are dealing with the risks associated with nasogastric tube feeding. Here in the second last point, you may see increased risk of gastroesophageal reflux with prolonged use, which is mentioned in the question long-term feeding. But in other words, prolonged use of a tube. So answer is gastroesophageal. Question number 18. If you need to give the patient a standard liquid feed, the tube to use is dash in size. So this answer can be found in text B. Here, in general, tube sizes of 6 French are used for standard feeds. So that's an easy answer. It's 6 FR, or you may write French. Question number 19. You must take out the feeding tube at once if the patient is coughing badly or is experiencing dash. That is also in the same text itself. If the child shows signs of breathlessness or severe coughing, remove the tube immediately. So answer for question number 19 is breathlessness. Question number 20. If a child is receiving dash via a feeding tube, you should replace the feed bottle after 4 hours. This information can be found in the last paragraph, in the last text. Here in the fourth point, feed bottles must be changed every 6 hours or every 4 hours for expressed breast milk. So if the child is receiving, yes, it's expressed breast milk. It's not necessary to write express, so it's optional. You may or may not write express there. Answer. The answer should contain breast milk. Now, part B. In this part of the test, there are 6 short extracts related to the work of health professionals. For questions 1 to 6, choose answer A, B, or C, which you think fits best according to the text. Question number 1. If vaccines have been stored incorrectly. As we go through the paragraph, we can see the cold chain is the system of transporting and storing vaccines with the temperature range +2 degrees Celsius to +8 degrees Celsius. Maintenance of the cold chain is essential for maintaining vaccine potency. As we read further, purpose-built vaccine refrigerators are preferred means of storage for vaccines. Here, despite best practices, cold chain breaches sometimes occur. So breaches may occur. Do not discard or use any vaccines exposed to temperature below +2 degrees Celsius or above +8 degrees Celsius without obtaining further advice. Isolate vaccines and contact the state or territory public health bodies for advice on the National Immunization Program vaccines and the manufacturer for privately purchased vaccines. Now let's go through the options. Option A, it says this should be reported, and that is what we have read here. Isolate vaccines and contact the state or territory public health bodies for advice on the National Immunization Program and vaccines. So it should be reported, and that's the right answer. So I'm going to discuss why option B and C are wrong. Option B says staff should dispose of them securely. There is no such information which says that it should be disposed. It is mentioned here that it should be isolated and then a contact must be made. Option C says they should be sent back to the supplier. Again, another option which is not mentioned anywhere, clearly are not given. Question number 2. According to the extract, prior to making a home visit, nurses must. As we go through the paragraph, we can see when the nurse is ready to depart, he or she must advise a minimum of 2 staff members that he or she is commencing home visits, with 1 staff member responsible for logging the nurse's movements. So he or she must advise a minimum of 2 staff members. So that's a form of communication. More than 1 person must be made aware of the nurse movements. Failure to do so could result in breakdown of communication and increase risk to nurse or practice. So there also they're talking about the importance of making them aware of nurses' movements and the communication, importance of communication. On return to practice, the nurse will immediately advise. Again, the nurse will be talking or communicating to staff members of his or her return. This time will be documented on the patient's visits list and then scanned and filed by administration staff. The nurse will then attend to any specimens, call chain requirements, restocking of the nurse kit and hazardous waste. So what is a must here? Question is asking, according to the extract, prior to making a home visit, nurses must communicate to other people regarding what they are about to do or what their intentions are. Communication is so important as per this particular text. Now let's go through each and every options. Option A, record the time they leave the practice. That is kind of thing that should be done by 1 staff member. Here you may see 1 staff member responsible for that, but that is not the most important thing as per the text, which must be done. Option B says refill their bag with necessary items. Again, that information is not right. Here in the last line, you may see the nurse will then attend to any specimens, call chain requirements, restocking of the nurse kit, and biohazardous waste they are talking about. It's not about necessary items, or they have not given any information regarding refilling their bag with necessary items. So that is also wrong. Option C says communicate their intention to others, and that is the right one. They need to. This nurse must communicate to other staff members what she or he is about to do when the home visits is about to start, when they are going to leave and when they are going to return. So answer is C. Question number 3. What is being described in this section of the guidelines? The paragraph says all biological waste must be carefully stored and disposed of safely. So it's about storing and disposing. Contaminated materials such as blood bags, dirty dressings, disposable needles are also potentially hazardous and must be treated accordingly. If biological waste and contaminated materials are not disposed properly, staff and members of the community could be exposed to infectious material and become infected. It is essential for the hospital to have protocols for dealing with the biological waste and contaminated materials. All staff must be familiar with them and follow them. It's all about how to store and disposing the biological waste, how to treat them in a proper manner in order to avoid any potential infections. The disposal of biohazardous materials is time consuming and expensive, so it is important to separate out known contaminated waste such as paper, packaging and non-sterile materials. Make separate disposal containers available where waste is created so that staff can sort the waste as it is being discarded. So let's consider the options right now. Option A says changes in procedures. So we have gone through the entire paragraph. We didn't see any sort of change in any procedure mentioned here. Here in the first paragraph, they are talking about the importance of storing and disposing the biological waste properly in a proper manner. And in the second paragraph, they are dealing with how they should be done, how storing, disposing must be done, because disposal of biohazard materials can be time consuming and expensive. In order to avoid that, they are talking about a practice that can be followed, which includes separating known contaminated wastes such as paper, packaging and non-sterile materials. So they're not talking about any change in procedure. They simply mentioned a particular procedure. That's it. No change is mentioned. So option A is wrong. Option B, best practice procedures. Yes, that can be right, because like I said before, here they are talking about how a method can be how this waste disposal and storing can be made much more time efficient and cheaper. So they might be talking about the best practice here. We cannot confirm it because we have not gone through option C. Let's go through option C as well. It says exceptions to the procedures. Again, can you find any exceptions mentioned here? There are no exceptions to any procedure, so that's clearly not a right answer. So answer here is B. Question number 4. When is it acceptable for a health professional to pass on confidential information given by a patient? When is it acceptable? When we go through the paragraph, we can find that where a patient objects to information being shared with the other health professional involved in their case, you should explain how disclosure would benefit the continuity and quality of care. If that decision has implications for the proposed treatment, it will be necessary to inform the patient of this. Ultimately, if they refuse, you must respect their decision, even if it means for reasons of safety, you must limit your treatment options. You should record their decision with their clinical notes. This is not what the question is about. We need to find when it is acceptable for a health professional to share the confidential information given by a patient. So it might be there in the second paragraph. Here it says, it may be in the public interest to disclose information received in confidence without consent. For example, information about a serious crime. It is important that confidentiality may only be broken in this way, in exceptional circumstances, and then only after careful consideration. This means you can justify your actions and point out the possible harm to the patient or other interested parties if you had not disclosed the information. Theft, fraud, or damage to property would generally not warrant a breach of confidence, which means it is clear from here that if it is harmful to the patient or other interested parties, then the health professional may pass on the confidential information, and that is not considered as a breach of confidence. So here option A says if known disclosure could adversely affect those involved. In other words, if known disclosure could adversely affect the patient or the parties interested. So option A is the right answer, but we cannot confirm it. We have got option B and C to be considered. Option B says if the patient's treatment might otherwise be compromised. As per this option, the health professional can pass on confidential information given by a patient if the treatment is compromised. No, they cannot, because here you may see ultimately if they refuse, you must respect their decision, even if it means that for reasons of safety, you must limit your treatment options. So you cannot really pass on confidential information if treatment is getting compromised. So option B is wrong. Option C says, if the health professional would otherwise be breaking the law. There is no such information regarding health professional breaking the law. So that's clearly not given. So answer here is A. Question number 5. The purpose of the email to practitioners about infection control obligations is to. As we go through the paragraph, we can find that you may be aware of recent media and public interest in standards of infection control in dental practice. As regulators of the profession, we are concerned that there has been doubt among registered dental practitioners about these essential standards. Registered dental practitioners must comply with the National Board's guidelines on infection control. The guidelines list the reference material that you must have access to and comply with, including the National Health and Medical Research Council's guidelines for the prevention and control of infection in healthcare. We believe that most dental practitioners consistently comply with these guidelines and implement appropriate infection control protocols. However, the consequences for non-compliance with appropriate infection control measures will be significant for you and also for your patients and the community. So it's all about the guidelines and the necessity of the dental practitioners to follow it. And they are reminding that the consequences of non-compliance would be significant for them and for the patients and the community. Now let's go through the options. Option A says, act as a reminder for their obligations. Obligations, the term obligation means the things that they are supposed to do. So definitely this paragraph is acting as a reminder for them to do what they're supposed to do. In other terms, remind them to comply with the guidelines. Option B, respond to a specific query that has been raised. No, there is no specific query that they have raised anywhere in this paragraph, so that's clearly not given. Option C, announce a change in regulations affecting them. No change, clearly not given. So answer is A. Question number 6. The results of the study described in the memo may explain why. Paragraph says, women's superior verbal skills could work against them when it comes to recognizing Alzheimer's disease. A new study looked at more than 1,300 men and women divided into 3 groups. One group comprised patients with amnestic mild cognitive impairment. The second group included patients with Alzheimer's dementia. And the final group included healthy controls. The researchers measured glucose metabolic rates with PET scans. Participants were then given immediate and delayed verbal recall tests. Women with either no, mild or moderate problems performed better than men on verbal memory tests. There was no difference in those with advanced Alzheimer's because verbal memory scores are used for diagnosing Alzheimer's. Some women may be further along in their disease before they are diagnosed. This suggests the need to have an increased index of suspicion when evaluating women with memory problems. Now let's go through the options. Option A says superior communication skills may protect women from dementia. No, that is not right. It is quite clear from the first line itself. Women's superior verbal skills could work against them when it comes to recognizing Alzheimer's disease. So superiority in verbal skills is not actually a good thing for them because it could work against them in recognizing this particular disease. So option A is wrong. Option B says female dementia sufferers have better verbal skills. This option can be connected with the information given in the paragraph here. Women with either no, mild or moderate problems perform better than men on the verbal memory tests. So you may say women perform better than men on the verbal memory test. However, we cannot really say that female dementia sufferers have better verbal skills because women with either no. So even after not having this problem, women were able to perform better than men. So a woman doesn't have to be a dementia sufferer to have a better verbal skills according to the test, according to the study conducted in this paragraph. So that is also a wrong one. You cannot really say female dementia sufferers have better verbal skills. No, that is wrong. Option C says mild dementia in women can remain undiagnosed. Yes, that is the right one. Because that's what they are telling by using the terms can work against them when it comes to recognizing Alzheimer's disease. And you can find further information in the last part. Because verbal memory scores are used for diagnosing Alzheimer's, some women may be further along in their disease before they are diagnosed. They might have progressed. The disease might have progressed in those women before they are diagnosed. So option C is the right answer here. It makes sense. If you liked this video, please let me know about it through the comments and don't forget to like, share and subscribe. You may click the bell icon to get prompt updates. Thank you for watching.